Hafa Adai Guam, I'm Jason Salas, and the Hafa Adai Pacific Medical Conference is happening very, very soon, this weekend in fact, and it is bringing together learned experts from the local community as well as our friends, doctors, physicians, members of the wellness community from Loma Linda University, an institution that we have covered here many, many years on the show and the very fine work that they do. We have three such physicians right here that are joining me right now. So gentlemen, welcome to the island. And
Thank you.
Welcome to the studio.
Thank you.
From SDA. Gentlemen, may I ask, would you introduce yourselves in your areas of specialty, if you would, please?
I'm Zeno Charles Marcel, and I'm an internist, geriatrician, diabetologist. So I take care of diabetes, and I'll be talking about reversing diabetes.
All right, Hafa Adai to you, sir.
Thank you.
All right.
Hi, Jason. My name is Laren Tan. I am a pulmonologist and intensivist, but I'm also the chair for the Department of Medicine at Loma University.
Excellent. We're happy to have you here, Dr. Tan. Thank you.
And Hafa Adai, Jason, it's good to be here. I'm the medical director of the Guam 7-Day Adventist Clinic, an internist by training, a father, a swimmer, and all those other good things.
There you go. Well, you've got a lot of work here on Guam. Like, very, very big sports community, but I'm sure as you gentlemen now know, very big concerns on Guam with our well-documented laundry list of medical concerns that we have here as a community. You're here for two basic reasons. Interestingly enough, they're coinciding at the same time. There's a medical conference, but also two medical outreach parts. There's two teams that you'll have, so you're basically canvassing the island. What are some of the themes, Doctor, we'll start with you, that will be covered?
A couple of the themes that we'll be covering at two different sites will be at Igania Heights near the mayor's office, and also at the village at Dado near the mayor's office again too. But even though it's two different sites, each site will be covering topics such as whole wellness, person whole care, how can we actually prevent a lot of the illnesses that we commonly see. Other things such as infectious disease, antibiotic use. At another site, we're actually going to be talking about lung health. We're going to be talking about the gastric and stomach health too. So all these various different topics will be addressed at two different sites.
Lung health is very important, especially these days, because I'm sure as you guys realize walking around the island, it's very, very hot and humid. Then it'll rain for 7 minutes, then go back to being real hot. A lot of people are developing allergies that never had them before, including my mom. So like very, very worthwhile.
Absolutely, and that is what we're starting to see that's becoming more and more apparent. And we don't know, is it the environment? I think that's part of it, but is it also the things that we're eating, the things that we're doing, the things that we're breathing in that is contributing to a lot of the symptoms that we're seeing?
Mm-hmm. And so on the topic of reversing diabetes, that's something certainly that I know a lot of people here would need to hear in the local community, because so many people find themselves in that situation. But I mean, behaviorally, medically, and dietarily and everything like that, it can be reversed if you...
It can be. And, we're not promising that everybody will get it reversed, but more people can be reversed than previously thought. In the past, people thought, well, this is an irreversible disease and some people get better. Now it's flipped on that, right? Most people can get better and some won't.
But it's kind of breaking through and making sure that they can really understand like the lifestyle changes they have to make,
Exactly.
and the self-discipline and the commitment to that.
Yes. What we'll be dealing with is some of the evidence for why this works and how it works.
Doc, please.
Yeah, I was just going to say it's a message of hope. The diabetes for so many, when I'm sitting here, on EPAL Road in the clinic, talking to patients, is like, I have diabetes. I'm like, good news. You don't have to have diabetes. Even if we can't get you into full remission, we can get you into partial remission, or help you become more controlled through very well established and evidence-based lifestyle interventions. So therapeutic lifestyle change of using the appropriate therapeutic lifestyle tools to help make the change is vitally important. And the cool thing is that the same principles that help reverse diabetes, reverse heart disease, reverse chronic kidney disease, reverse mild cognitive impairment and dementia. I mean, it's the same basic underlying risk factors and the same basic lifestyle interventions that can help to change.
With infertility, people who have polycystic ovary disease as a cause of their infertility, women, this will help them too.
So maybe the message we want to get across is the same general ideas. I mean, there are differences between, whatever healthcare affliction you may have, but the same core principles and everything can apply in your life in many different ways.
That's correct.
Okay, and I should also add, Doc, that SDA clinic for many, many years has had a very successful treatment treatment program for diabetes. And
Absolutely, and we just did a Oh, awesome! And we just did a refresh on the program. I'm super excited about this because we've taken the diabetic program, which we've had for years, and we have started over and kind of made it, scrubbed it over and cleaned it up, and it's now a very interpersonal interaction where you have not only the knowledge, communication, but there's practical demonstrations. You go for a walk with a dietitian. I mean, it's all those different components that teach and start patients on a journey for lifestyle change. And what's awesome is that the insurance companies covered either 100% or almost 100% for the diabetes program. So yes, if you have diabetes, we are here to help.
And you know the pulse of the community too. You know, like our elderly and some of the concerns that they have, some of the problems that they have, and everything. So your perspective certainly very well.
And it's I never imagined living in Guam. It's been almost 4 years now, 3.5 years and counting. And I just purchased a house. I'm going to be here for a while. I mean, I'm a transplant to Guam from British Columbia, Canada. I grew up on a fruit farm, and now I'm here, and I'm meeting I've met so many wonderful, beautiful people, and so many of them have that agricultural thumb at some point. Some family connection that has either a small garden or growing something. And so the natural tools for healing our lifestyle-related diseases are well known by this community. And if I encourage many patients and many conversations I have, encourage you look back at your ancestors. What was the lifestyle 100 years ago, 150 years ago, before a lot of the Western influences came in, a lot of the packaged goods came in? There was no diabetes, there was no amputation, other than a traumatic amputation maybe. There was, relatively speaking, no heart attacks. I mean, sure, did they happen? Yes, they did happen. But is it to the magnitude that we're seeing today? No.
So science has marched on, as they say. I should also add that your proud Canadian team taking a really good basketball team into the Olympics about a month from now and everything. So
go Canada.
If they do in fact take the gold, we'll have you back here on the show to please sing Go Canada.
Okay, I can probably stumble through it. Don't make me talk about basketball because I have to admit I don't follow it.
It's on record now, everybody. Okay.
But Canada.
There you go. Thank you. We'll save that for the gold medal match. All right. Well, the Hafa Adai spirit continues with the Hafa Adai Pacific Medical Conference. Let's talk about that and some of the themes that will be in there.
We are really covering from head to toe. We felt it was so important to be able to integrate not only what we felt was important, but really what was the pulse and what was actually needed to be addressed on the island. And so we got a lot of topics from Dr. Thorpe, from the community, to be able to talk about specific topics such as acid reflux. We're going to be talking about asthma, obstructive airway disease. We're going to be talking about a prevalent more along the lines of like it's in the inpatient side, but when you actually get an infection, something called sepsis, and an inflammatory response happens that has a high mortality, or a lot of people die from it. How do we actually treat that? Other issues, mental health, right? Yeah. So these are some of the core topics that we're actually going to be talking about, but other things that we're really excited about also is that we've pulled back physicians that used to be here that went back to the mainland that are coming back to actually speak to in the audience too, like Dr. Robinson.
Yeah.
And that's the one thing we want to point out though is that the conference itself is not just for board certified physicians, like yourself. It's for the entire system of care, anybody who's in right. that. And we've got, travel nurses now on Guam, our friends in the military, EMTs, many people who work in the wellness system.
Absolutely. And I just want to point out the caliber of people that Dr. Tan has been able to pull into this is phenomenal. On the topic of sepsis, Dr. Nguyen is one of the world's foremost leading experts when it comes to sepsis. I mean, here is someone who's written the national guidelines that are now adopted, globally into many health systems, or parts of the guidelines are adopted there. So here you have coming to the tiny little island of Guam out in the far western Pacific, some of the world's experts in some of these areas. So we're, as a clinic, we're really proud to be co-sponsors with Loma Linda for this and to help the professional community improve and enhance the level of care that we're providing here in Guam.
But can people still register?
Absolutely. So registration is open up to the time of the conference beginning on Sunday morning. And so please come and join us if you're a healthcare professional and you're looking for CEUs or CMEs or any other C whatever it is for credit. You're welcome to come and join us. And,
come and see the experts, and you can take away the
there
information.
There we go. And come and gain those important credits to help maintain our board certifications.
All right. Well, typically Sunday is the day of rest, but on this Sunday, it's going to be a day where information will be shared, networking is readily available, and these gentlemen and their colleagues bringing the system of wellness again to Guam and strengthening our medical community here. So, gentlemen, we hope you have a wonderful trip. Enjoy the beach. It's a
Thank you.
Good time.
Thank
Good
you.
time to go hang out after you get some business taken care of. Yeah, and we thank you for your service.
Thank you.
Thank you. Thank you very much.